Hi, everyone. Welcome to our Family Matters interview today. We are joined by Bill Vaughn, and we are excited to have him joining us and sharing his expertise on the topic of medication management in older adults, benefiting from medication while managing risk. Bill, welcome.
Thank you, Lynn, very much. And welcome to everybody that's on this. I'm very glad to be doing this with you.
Thank you. We're so glad you took the time to join us. Bill, before we even start, can you tell our families a little bit just about yourself, your background, and your current role?
Sure. So I kind of choke up every time I say this, but I've been a nurse for over 40 years.
Congratulations.
Yeah, well, or sympathies, one of the two, I don't know. But being a nurse is great. I started my career at University of Maryland and Hopkins, and then for the next 30 years or so, I worked for the state of Maryland government, and my job was to regulate healthcare facilities. So I oversaw nursing homes, assisted living, hospitals, hospice, lots of different things in that role. And I will tell you that in that role, medication management was a top tier item because across our healthcare continuum, medication management is really important. So I got a lot of benefit there. I retired from the state and then worked for the next 8 years at a long-term care pharmacy. And this is a pharmacy that exclusively services nursing homes and assisted living facilities. And so there, of course, we focused heavily on medication safety. And then at the height of the pandemic, for some reason, I'm not sure why, it possessed me to become a consultant on my own. So since 2021, I've been a consultant in long-term care. So I still go primarily to nursing homes, but sometimes assisted living as well, and help them manage their complex clinical problems. And honestly, medication is usually at the top of that list.
Yeah, well, it sounds like in this vast career that you've had and all the experiences that you've had, you're going to be able to share a lot of important information with our family members about sort of that medication in the older adult, what to be on the lookout for. Before we dive into any questions, what do you think are, three of the key factors or topics that are most important, to families who are helping support an older adult with their medication?
Sure. And let me say, it's medication management for all of us is a tough thing to do. Even on the best of days, there's lots of things that can go wrong. So it is really important that we look at medication management as a team effort, right? The prescriber, whether that's a doc, a nurse practitioner, or PA, is your partner. The pharmacist, I don't think we leverage them enough. When I pick up my drugs, I have to sign something that says I accepted consultation with them. And I see everyone in front of me just signing that and not asking. I usually try to ask questions, because as good as our docs and nurse practitioners are, pharmacists are much more focused on medication. So they're really expert in it. And so I think you families and caregivers should leverage that expertise. And of course, patients and caregivers are equally important in this equation, because one, we have to make sure that the docs and pharmacists know what other meds the patient might be on, what allergies they may have. And that includes over-the-counters, herbal stuff. So it's really important that we push information to our healthcare providers rather than just receiving it. When a prescriber wants to start a pill, I think at a minimum, the conversation should include something to the effect of, why are we giving this pill? What are we trying to do? What are the common risks of taking it? And is there any alternative, right? So when we look at lots of drugs, I mean, if you have a pneumonia and your doc prescribes an antibiotic, it's pretty obvious that it's to treat the antibiotic. But when we talk about risk, probably not everyone knows that every antibiotic carries the risk of a really serious and very uncomfortable condition called C. difficile. It's an infectious diarrhea that 8 to 10% of older people get when they get on an antibiotic. It's the biggest risk factor for doing it. And the question is, if you knew that, would you still take the drug? Well, I think it's a good idea to talk to the docs and NPs when it's prescribed too. When you see your pharmacist, ask them questions like this. What do I do if I miss a dose? Do I double up on the next one? Do I just forget about it? How much time do I have? And this is another really important one. If the doctor orders a drug 3 times a day, ask your pharmacist if there's a formulation that has something we call like an extended release version, where you can take that drug just once a day and get the same effect as taking it 3 times a day. Docs are great, NPs are great, but they may not know a new formulation or something like that, and consolidate that dosing, because juggling multiple times to take meds is, really tough. One other word on allergies. I think when you tell your prescriber that you have an allergies, I'd like you to go ahead and not just say I have an allergy, but describe what your allergy is. There is a big difference between, if I took this medicine, if I took penicillin, my throat swells up, my lips swell, I have trouble breathing, I wheeze. That sure does sound like an allergy, as opposed to, oh, I remember years ago I took iron and it really made my stomach hurt. And ever since there, I've felt like I was allergic to it. Well, it's really not an allergy. That's really an adverse reaction, and one we know about. So I think one of the tasks you should incorporate when you're talking to your providers is describing your allergies rather than just saying what they are. I have another resource I want to talk to you about. For those people that are on Medicare or in a Medicare Advantage plan, there's something that's called medication therapy management that all plans have to provide. Now, what this is basically is a meeting with a pharmacist that looks at your current medications to see if there's any interactions that are problematic or things you should be doing differently. Then they develop a plan going forward on how to take your meds, what you should be monitoring for, all kind of things like that. And then it's important that you ask your provider, your Part D provider, whoever that might be. If you're with a managed plan, ask them. If you're strict Medicare, ask your a pharmacist when you go pick it up, am I entitled to medication therapy management? And we're going to put, at the end of this talk, we're going to put some links to resources, and I'll make sure there's something there about that as well. So team sport, right? Don't try to do medication management by yourself. There's lots of resources out there. I'm 65 years old, and I have a pill box just like everybody else. And if I'm honest, am I 100% compliant with my meds? Probably not. It is just really tough to do that kind of stuff. So that's number one. Number two is something called non-pharmacological interventions. And this is an approach that says the best pill you ever take is the one you really don't take.
I love that.
Yeah. If you can accomplish something without taking a pill and having to deal with the risk of the pill, that would be great to do, right? Now, in many circumstances, going back to the pneumonia, there's no magic non-therapy that we can think of for that. But things like pain, opioids have been in the news a lot. There's lots of downsides to them. They're very good under many conditions, but they do have side effects. So if the kind of pain you or your loved one is having is localized to your knee or your lower back or something like that, talk to your doc about physical therapy and see whether that's a reasonable approach to see if it's better. Direct heat and cold usually works. Nerve stimulation is out there too. Even if you have to take a pill, maybe you have to take less dosage if you're getting therapy or something else. Another area that we see this in is sleep medication. Lots of people, as we get older, have trouble falling asleep or staying asleep. And lots of sleep pills are put out there. They're not, there's no pill that doesn't have side effects, and you can run into some problems with sleep medication. So something that we call sleep hygiene, what are we doing to create a sleepful environment, right? So how much caffeine are you drinking during the day or taking in during the day? Before you go to bed, are you cooling the room down? Are you making sure it's dark? Have you considered using white noise, that kind of stuff? So there is a lot you can do without taking a pill. And I mean, our culture, all of us, including myself, wants to take a pill and not worry about anything else. But with that comes the risk of every pill. So that's something we just have to keep in mind. And then the third thing, I think we want to make sure we're looking at quality of life when we look at medications. And that can be as simple as something like this. Many people take the drug Synthroid for a low thyroid activity, right? And most prescribers say, take it at 6 a.m. in the morning. And the reason they say that is it's because Synthroid is best absorbed when your stomach is empty. However, if you are stable clinically and your lab tests show that you're getting the right amount of Synthroid, as long as you take it every day at the same time, you can not have to wake up at 6 a.m. Now, of course, talk to your provider about this before you make any changes. But taking Synthroid at 6 a.m. is more about Synthroid than it is about you. It's more about getting the optimum time to take a drug rather than the impact it has on your quality of life. And frankly, I think there's not enough attention paid to sleep as we age. I think it's incredibly impactful, and we don't pay enough time and effort to getting good sleep. So look at things like that. Again, when we talk about timing of meds, if you are stiff in the morning and getting out of bed is a real long effort, maybe taking a pain med if you're taking anti-inflammatories, which there's lots to be said about that. But if you're taking something, pre-medicate yourself before you get out of bed. Go ahead and take your medication rather than trying to hit getting out of bed cold and going from there. Again, that it will improve your quality of life. And just keep in mind that medications are complex. Always talk to your prescriber and your pharmacist about this. And lastly, I want to say that I'm not a big fan of real strict medication time, but there are some drugs where strictly adhering to medication times may be very important. And one that comes to mind is Synthroid. That's a drug, Sinemet. That's a drug we take for Parkinson's disease. Some people, if they don't get their drug right on time, 10 minutes later can be showing adverse effects from Parkinson's. So again, we call this kind of patient-centered care. We're looking at the uniqueness of every patient. We're looking at the uniqueness of the drugs and trying to put this equation together so medication is really your friend and that you have the best quality of life when you're taking it.
It makes a lot of sense. I like how you're talking about creating routines that are specific to the individual, that will work for the individual, and that will hopefully promote adherence and success down the road because it fits their day. It fits the way they normally, if they're not a morning person and they like to sleep in until 9:30 or 10, maybe they could take it a little bit later. So I love that discussion around and the thought process behind kind of thinking about what will work for someone and trying to layer the medication on top of that instead of trying to make the medication the driving force and
Right.
having folks try to kind of work their day around that.
Right.
So that's really kind of an interesting way of looking at things. You talked a little bit about the team approach to managing medications. And what we hear a lot from our family members and from older adults out there, they have to take medication for maybe a chronic condition that they've had for some time. And then all of a sudden something new crops up. And now they get a new medication prescribed. And I know sometimes there's that concern. you add 1 to 2, and then maybe something else gets added in, and all of a sudden, either the older adult or the family starts thinking, this seems like a lot of pills here. This seems like I went from, 2 pills to 6 pills. What is your suggestion to open up some dialogue with your health practitioner when you find yourself in that situation?
Well, that's a great point, and it's not an unfounded concern. We've come to learn that the more medications you take, the higher the risk of an adverse drug reaction. Seems intuitive, but it's true. There's been cutoffs proposed for how many medications are safe. None of them really stick, but when you start taking more than 10 medications a day routinely, it may be time, again, to say to your doc or your pharmacist, is there any other way to approach this clinical condition than with a medication? Before this talk, I looked up on the CDC's website. There's 1.5 approximately million ER visits every year for adverse drug reactions.
Wow, that's concerning.
And about 350,000 of those 1.5 million have to be admitted. And of that group, a substantial part are people over 65. Because as we get older, I'm preaching to the choir, I'm sure, but as we get older, our kidneys don't work as well. Our immune system doesn't work as well. And drugs don't work the same in our bodies as it would in my kid's body, my 30-some-year-old daughter's body, right? So avoiding adverse drug reactions is a reasonable thing to think about. And by limiting the total number of pills you get is a good way to do it. And it's interesting because there's lots of, again, we're kind of a pill-centric society. If all of us took great care of ourselves, did exercise, ate great, no one would need statins for their cholesterol, and diabetes wouldn't be an issue and everything, but that's not reality either. So I think it is good to recognize it. It's good to talk to your prescriber about, I'm on this list of pills. And one thing comes to mind too, is that if you see more than one doctor, and many of you do, coordinating that care is really important, because when you go to a specialist, and we're so lucky in our area, I mean, I live in Maryland, and we have just all these resources. When a specialist looks at you for your heart, for your liver, for your kidneys, they really very narrowly focus like a laser on that system. And they don't necessarily look at the impact on you as a total person. That's what your primary care doc is supposed to be doing. So one, it's real important that you're transparent with your primary care doc about seeing doctors and what they ordered. I also think this is a good time to remind people that knowledge is power. And if you can get all your medicines from the same pharmacy, what that will do is help the pharmacist reconcile everything you're on. And every pharmacy now has software that checks every drug you're on with interactions. So I would advise against using multiple pharmacies. Going to one is smart. And I would even advise, if you are comfortable with a health system, every hospital now seems to be established as a health system. And once you're in that health system, your records are pretty portable and transparent to other people. So again, in terms of this, looking at number of meds and making sure that everyone realizes what they're for, if you can choose a health system that you're comfortable and happy with, and through my chart and other ways, share your medications with all your providers, I think that's a step in the right direction as well.
I love that. That's a great point. I know sometimes for older adults who might be having some memory issues, or, they have their list written down, but they forgot to put it in their wallet the morning before their appointment. It can be challenging when you're in an appointment and someone says, what medications are you on?
Right.
And then they want to know, what's the dosage? That's a lot of information for someone to just kind of remember off the top of their head. So if you can rely on the medical record to do the remembering for you, or even as a backup, having a little cheat sheet or piece of paper tucked into your wallet so that you always have it with you. That's a great suggestion, just to ensure everyone's fully informed about what you're currently taking before they add something new or different to your routine.
And good luck trying to pronounce most of the names of the drugs you're on, right? I mean,
Yeah.
I think
Nobody knows what any of those words mean.
no, you know, I think someone has played a cruel joke on all of us by the way they name drugs. And yeah, it's very tough.
You talked a little bit about folks that are on multiple medications being at higher risk for, side effects and adverse reactions, even admissions to the hospital. I know I've heard, and I know some of our families have probably heard the same, that sometimes there can be correlations to even things like falls if you're on multiple medications. Can you tell us a little bit more what to be on the lookout for? What should we be considering, or what are some good follow-up questions if we do find ourselves on multiple medications that we could ask our provider, so that we do know if we have additional risk factors to kind of be mindful of?
That's a great point. So there's an axiom in geriatrics that says this, that in someone over 65, any change in condition, if you start falling, if you start bleeding, if you have a change in mental status, you're more confused, or you're newly confused, or you see a change in their personalities, first look at the drugs, because we know that older people are more sensitive to drugs and their adverse effects. So that is a great point. Make sure your provider knows, even if it seems relatively minor to you. Oh, she was confused, but she's straight now. It only lasted a couple hours. That's really important for your provider to know. There can be lots of reasons for that, but medications frequently are at the top of that list. And it's stuff that you wouldn't even think of, like, bruising. We all get bruised, we hit things and stuff like
Sure.
that. But if you're on a medication to prevent a stroke from atrial fib, a heart condition, that can be directly related to having too much of that drug in your system, right? Even something as benign as coughing, you'll be amazed that a drug in a class called ACE inhibitors that we use for blood pressures and cardiac stuff can cause coughing. So new onset of coughing, most people in January or February, whatever we are this year, will think of respiratory viruses. And
Sure, that'd be the first thing you'd attribute it to.
and looking over the past 3 years, you'd think COVID, right? The
Yeah,
first thing you
even
think
worse.
of. But it can be something other than that. So transparency with your provider about any change in condition that you're not comfortable with, or just that you notice, make sure they know, because we consider looking at drugs an important first step when someone has a change in condition.
Are there any specific types of medications, even over-the-counter medications, that older adults are more sensitive to, or might want to just be more educated around, maybe drive more side effects or have more adverse reactions? What are your
Yeah,
thoughts on that? Because I know even over the counter now you can get vitamins. They have, all kinds of different supplements available. And oftentimes, people hear word of mouth, hey, I tried
sure.
this, and they go out and they just, grab it off the shelf. How do our older adults or our families who are supporting them navigate, recognizing what's okay to try and what should you kind of run past your physician?
Yeah. So if you're buying stuff like that, you're in a pharmacy, ask the pharmacist for one. But a particular class of drugs that you don't normally think of right away are drugs that we call anticholinergic drugs. Benadryl comes to mind as one. Anticholinergic drugs give you some side effects like dry mouth or urinary retention, but they're also implicated in falls and other outcome related stuff. So providers often try to stay away from anticholinergic drugs. And recently, I think the FDA is taking a number of cold medications off the shelves because they've been shown to be not very effective, which is, I think, something every parent knew for the last 100 years. But anticholinergic drugs, people took Benadryl for sleep, and a 20-year-old can take Benadryl without much problem. A 70-year-old would want to avoid it. And when you talk about vitamins, there are fads all the time that come and go. And most people that take vitamins, if they don't need them, they're just having expensive urine because they're being urinated out. But one class of vitamins that we call fat soluble aren't just an inconvenience when it comes to your money. They are fat soluble and can be retained. A great example, everyone thinks that vitamin D is the save all for everything, right? It prevents Alzheimer's, it prevents COVID, it does everything. And I think it's an important vitamin, but you can take too much of that and cause yourself a real problem. So I would say, be careful with following fads, for one. I don't, just because your cousin takes it and her skin cleared up, I'm not sure that's the best recommendation you should follow. And if you're thinking about doing it, dose and duration, how long you're going to take it for, how high the dose is. Again, I would lean heavily into the pharmacist that's selling you that stuff and ask them about it. And then make sure if you do take it that your prescriber knows.
Okay, that's a good tip. Make sure any vitamins or things you're taking at home get added to your overall medication list.
Yeah, and
Okay.
there's people took St. John's wort for, I think, depression, and that was a fad, and no one talks about it anymore. So just in this day of information that's out there, just be very careful about who you're relying on. I mean, I think you ought to have a very good working relationship with your primary care provider. There's important that you have a strong relationship with them, as well as your rest of your healthcare team. I'm reluctant to say the internet is the best place to be finding information about healthcare.
Right, for sure. I know we're almost out of time. Are there any trusted websites or resources or places you would recommend older adults or families can use as sort of a go-to resource when they're starting on this journey of trying to fully understand, the role of medication and better understand maybe what they are taking?
Yeah, I'm glad you said something, because we are going to put references at the end of this presentation for you. And the two that I'm enamored with is, again, the Peter Lamy Center is at the University of Maryland Pharmacy School, and it looks at medication management in older adults. They have a wonderful website with lots of consumer-related information, and we'll make sure you have access to that. The other one we'll give you is from the American Society of Consultant Pharmacists. These are pharmacists that heavily focus on older adults as well, and spend their time reviewing what drugs older adults take and the interactions and doing research and things like that. So you give you that one. And the third one we'll give you is a link to better understand medication therapy management that we talked about earlier in the program.
Great, that sounds perfect. I'm sure a lot of families aren't aware of the medication therapy management, benefit, and maybe haven't tapped into that before. So that can be another great resource that's already part of your health insurance that they may not even know that they're missing out on. So
Correct.
That's great information. Well, you've given us a lot to think about and a lot of great sort of actionable items that we can immediately take with us and open that dialogue with our family practitioner, really make sure we fully understand what medications we are on and what they're for, and then to really look at integrating things into our routine in a way that is going to be sustainable. It's going to sort of fit our lifestyle so that we're successful at it. So I think there's some really good takeaways that you've shared today. I really appreciate you taking the time to fill our families and our older adult audience members in on this really important topic.
Thank you, Lynn. And I wish the best to everyone watching this and in managing your loved one's healthcare. For those of you that are caregivers, God bless you. That's a tough job. And your loved ones are lucky to have that safety net as well.
Absolutely. Well, that concludes today's topic. We thank everyone for taking the time to join us, and we look forward to you joining us in the future on the next topic. Thank you so much. Have a great day, Bill.
Thank you.
Bye-bye.